This person has chronic back pain and they're getting a gym membership to help with it. Okay, starting a gym to help chronic back pain. I love it. I love it. I'm a little nervous to start, hoping to get some guidance. Little background, 31, 5'10", 185 pounds, grew up decently fit, perfect. Skateboard a lot and was very active. Past 5 years I've stopped most of my activity besides my job. Work construction, so it's fairly active. Okay, so that's a good start. You're already doing a lot of, just general, like picking up probably 20 to 30 pound objects multiple times a day. You're on your feet, whatever. A few months ago, I hurt my back lifting something that was maybe 20 pounds. Okay, we just talked about this. Had a pinched nerve, and ever since I've had issues with my back. Been going to the doctor, aren't able to find anything seriously wrong. Question is, where should I start? Pretty much no gym experience. A little bit of guidance if anyone could help. All right, so anytime you experience pain in your body, one of the biggest things I want people to realize is that your pain is in your head. Now, this might sound condescending, but hear me out. Anytime you feel pain in any part of your body, it's actually because the nerve signals around that area of your body, let's just say your lower back, for example, are sending a pain signal up your spine and up your central nervous system into your brain, and that brain is then translating it into, okay, something's wrong here, we're gonna send back a pain signal, okay? That's where tightness ensues, that's where inactivity ensues, and usually this is okay at start. Like if you roll your ankle really bad, you want pain to be sent to that area because you're not gonna wanna be physically active, you're gonna wanna rest it. But it can be a problem when it comes to chronic pain like this individual is talking about, because the pain signal is always there, okay? So the first thing, there may be something wrong. There may be something wrong. However, it likely is being overblown in the amount of pain you're actually feeling, okay? And a lot of times, if it's going on for a really long period of time, the pain or the tissue or whatever damage happened will likely be gone, or at least less severe than it was before. But what happens is that nerve in that area is still really sensitized to movement because it's scared of it happening again and becoming worse. So a lot of times when it comes to physical therapy, what they try to get individuals to do is this idea of desensitizing the area to pain. And usually how this works is by slowly progressing them through greater and greater ranges of motion with greater and greater loads from a point that they can tolerate. So I'm going to use one example here, and this will apply to any movement that he does in the gym or any type of movement that causes pain. You will try to do a movement that causes pain right off the bat in a way that doesn't cause pain, right? Duh. How does this look? They have lower back pain, so let's say they're doing a deadlift. We're gonna work off a deadlift. So there's a lot of different ways that you can variate a deadlift to, variate, is that a word? Variate. That you can vary a deadlift to make it easier and not as stressful on your body and back. And I will say stress isn't a bad thing, but in cases of pain, you do need to tread cautiously because pain can flare up really quickly. So one of the first things that we can do is obviously work on our load. How much weight is on the bar if we're deadlifting? Did you realize you can deadlift no weight? Literally bend over, touch the ground, and stand up. That's a deadlift, it's a hinge, but you're just not using any weight. So can you deadlift or hinge over with no weight? Great. Let's try deadlifting and hinging over with a 10-pound dumbbell, or maybe just a backpack with a couple books in it. That's like 3 to 5 pounds. No problem there? Great. Keep adding load until you get to a point where you're like, yeah, this is kind of dicey for me. That's the first one. The second one you can do is to monitor your overall range of motion. So if picking something up off the ground, regardless of how much weight in it, is really, really difficult for you, what you could do instead is try to pick up something from knee level. So I do this a lot of times with seniors I worked with. I would place something down on a bench or a chair, let's say like a really light dumbbell. So they're still bending over to pick up that dumbbell, but it's a really decreased range of motion. It might only be like, let's say 3 to 5 total pounds, but they're not going down nearly as far. So decreased range of motion, the muscles and the joint angles aren't nearly as demanding and getting used quite as heavily, but it's still practicing that movement. The last thing is tempo. Anytime you increase the speed, there's a higher likelihood of the rep getting misgrooved, you not using your muscles or engaging them properly, and just some potential error that could lead to tweaks or muscles getting used a little bit more heavily than they're used to. So slower reps, less range of motion reps, and less weight. Those three things all together, if you accompany that into any exercise you're doing, you will likely be able to find some variations of movements that you can do without pain. This is a great thing. So this is what I would do anytime you're going to the gym. Start off very light with your weights. Start off with a decreased range of motion with your weights, and start out very slow. And as you build up weeks, as you build up days, months, etc., try to push it to more and more. And over time, you'll hopefully have no issues at all with any of this and be feeling really, really good in the gym